Diabetes is a chronic disease leading to elevated blood glucose levels. It can lead to complications such as cardiovascular disease, kidney failure, amputations, and blindness. Control of diabetes requires lifelong treatment with medication or insulin. There's now international scientific consensus that metabolic surgery can achieve long-term remission of diabetes by altering the way our gut handles the food we eat.
Our clinic offers a unique type of surgery for type 2 diabetes. The operation will help the patient in a few ways. The first way is weight control, which indirectly will help diabetes. And the second way, the operation provides a platform where the patient's pancreas does not utilize so much insulin. Improvement of diabetes will be lesser medication and total cure of diabetes. This is both achieved with at least 60 to 80% success, and in the long run, 80 to 90% success in the first 2 to 3 years.
We now have a number of very good randomized controlled trials that show metabolic surgery is superior than medical therapy in controlling diabetes. The results of these trials show that up to about 80% of patients actually do not require any medication for diabetes after the operation.
The principle of this operation has two different paths. The first one will be weight loss. The second method is the unique feature of this operation. Food bypasses the biliopancreatic area or the pancreas where insulin is produced. Therefore, the pancreas doesn't have to work so hard, and therefore your diabetes resolves. And this starts even before weight loss occurs.
In fact, we find that many patients begin to experience good glucose control and do not require any medication immediately after the surgery. We also feel that patients should come for surgery at the earlier stage, newly diagnosed or are reasonably well controlled on 1 or 2 medications, but you prefer to be off medication. You may choose to undergo metabolic surgery to reverse your diabetes, and the results are extremely good for these patients.
The recovery stage is very short. It is done laparoscopically, in other words with keyhole surgery with 5 very small wounds, and therefore within the first day you're walking around and moving around. You're even able to have slight drinks. Hospital stay ranges between 2 to 3 days. So complication rates for these procedures are very low. After the procedure, not only do we do gastroscopy to check for the integrity of the joints or integrity of the staple lines, we watch you very closely for at least 1 to 2 days.
If you are thinking about having a metabolic operation, if you're coming from overseas, email us to find out more, and we can explain the procedure to you so that when you come for surgery, you're mentally prepared. Plan to stay in Singapore for about 5 to 10 days in order for us to do the surgery and for you to recover fully.
The most important thing for my patients is they have to be motivated, number one, and secondly, they have to be ready to change their lifestyle just a little bit to have a better diet and to increase their exercise levels, and of course to mentally prepare themselves for cure of diabetes.